And I unmute myself.
Okay, good. Good evening, everyone. This is our weekly town hall on COVID-19. And as we stated last week that we would have a presentation, a CE presentation again this week. And we are glad to have Badrea Nigocevic with us, who's Assistant Professor of Clinical Services at Roosevelt. And this, for some of you who may have attended North Suburban, some of this will be a minimal review from last night's lengthier program, but we wanted to make sure this important information was shared with everyone as we continue to update and progress not only with treatment options, but more importantly with a vaccine, and just was looking at immunization administration during COVID. So, Badrea, I'm going to turn it over to you.
Thank you so much, Garth. And I will let you know before we get started that every once in a while my internet connection does cut out. So if that happens, someone please tell me that you can't hear me, and I'll go back and repeat the things that you weren't able to hear. So it is a pleasure to be back here with IPHA tonight talking about immunization administration during the COVID-19 pandemic. If you expected to hear everything there is to hear about immunizations for SARS-CoV-2, this is not what we're going to talk about tonight. So tonight's presentation focuses solely on actually how to administer the vaccines during this period of time. Before we get started, I do want to point out that I don't have any conflicts of interest, and I have no financial interest in any company product or service mentioned in this program. They don't pay me any money to talk about any of this, and I'm really not talking about any companies except the CDC, which isn't technically a company. We have one objective for this program. It is a very short program, so only about 15 minutes, but by the time we're done with it, both the pharmacists and the pharmacy technicians will be able to discuss the CDC recommendations for immunization administration during the COVID-19 pandemic. We do have one pretest question. It is a select all that applies, so my students' favorite. Which of the following is true regarding vaccine administration during the COVID-19 pandemic? And it's a select all that apply question. A is pharmacists should continue to administer vaccines when necessary. B, pharmacists should utilize appropriate personal protective equipment while administering vaccines. C, pharmacists should determine whether workflow changes are appropriate to ensure safety and well-being of their staff and patients. And D, pharmacists should delay administration of all immunizations until COVID-19 pandemic is over. And we're going to take a look at the answer to this question when we're done talking about some of the things that we're going to talk about tonight. So let's begin by talking about why we actually need to have this guidance for immunization administration. As you all know, coronavirus disease is something that has been spreading rapidly globally since we first became aware of it back in late 2019. It is a disease that's caused by SARS-CoV-2 virus, which is spread mainly via respiratory droplets. Since the beginning of the pandemic and shortly after it started really becoming aggressive in the United States, there were multiple measures that were implemented in order to help decrease the spread of the disease. And some of those measures included stay-at-home and shelter-in-place orders. There is some thought that these orders and other measures may have contributed to a significant decrease in the number of non-influenza doses and measles-containing doses of vaccines, as found by a study conducted by the CDC and published in MMWR. Because of this, there is some concern that this may be reflected in the upcoming influenza immunization season. As we all know, influenza immunizations become available typically at the end of July, beginning of August. We are still seeing an awful lot of cases of COVID-19 diagnosed every day in the United States. So there is concern, of course, that there may be a decrease in the amount of immunizations that are administered because of concerns from patients in coming into our pharmacies to obtain immunizations, but also concerns from pharmacists in administering these immunizations to patients and their ability to protect themselves. So in order to address some of these concerns, the Centers for Disease Control and Prevention provided guidance for administration of both pediatric and adult immunizations. In their initial guidance, the CDC stated that visits should be postponed unless the patient already has an in-person visit scheduled for a different reason, and there is no additional risk in administering the vaccine during such a visit, or there is a compelling need to receive an immunization. And the compelling need could be due to a lot of different reasons. So it could be things like having a patient who is pregnant and will be delivering soon and needs to receive a Tdap vaccine before she goes into delivery, or having a grandparent who is expecting a grandchild soon and needs to receive a Tdap vaccine, or anything like that. In addition to that, their Measles and Rubella initiative released a statement, and their statement again focused on the decrease in the amount of measles immunizations that were administered in recent times. And their primary concern was that we can't forget about the children who may have missed out on immunizations during this period of time. So they talk about strategies that should be taken to ensure that those children are eventually caught and scheduled for these immunizations and appropriately immunized. More recently, the CDC actually released guidance for adult immunizations as well. And this guidance is specific to pharmacies. And what they state in this guidance is that we should consider administering the vaccines if there is no additional risk to the patient or the provider. Now, depending on the patient or the provider that you talk to, they may claim that just coming into a grocery store or into a pharmacy may pose additional risk to them. If you're speaking to a pharmacist who may have a variety of concomitant conditions, or who may be immunosuppressed, they may be concerned about their ability to administer these vaccines safely as well. So we'll talk about that a little bit more later on. The other thing that the CDC recommends is that we prioritize our high-risk groups. So if we are administering immunizations, and if we're considering limiting the number of people that are allowed in our stores in order to receive these immunizations, we should prioritize our high-risk groups. So our patients over 65 years of age, those with concomitant conditions, those who are immunosuppressed, et cetera, et cetera. Additionally, the CDC does recommend implementing screening strategies for COVID-19 symptoms before having the patients come into our stores or into our pharmacies to obtain these immunizations. So this could be done in several different ways. The CDC does not provide guidelines on how to screen patients, but one of the things that I would consider as a pharmacist is having a questionnaire available online that a patient could fill out that would be a step-by-step essentially that says, you know, are you currently experiencing any of the symptoms, et cetera, and then there is a flow chart that essentially leads them to a stop, don't come into a store, or you may come into the store in order to receive an immunization. Finally, the CDC does recommend that pharmacists continue using standard precautions, so our universal precautions and personal protective equipment as appropriate. Specifically, they mention use of masks for both the provider and the patient, and hand hygiene, including the use of gloves, but also making sure that we're changing gloves in between patients, in addition to washing our hands before and after every immunization. They also recommend eye protection in areas where there is substantial community spread of COVID-19, and they recommend that this be considered in areas where the spread is moderate or low. So with that, these are some of my musings with regards to ourselves preparing for flu seasons, for the upcoming flu season. Again, the last thing that we want is to have COVID-19 pandemic, and then on top of that have an influenza pandemic, because our patients are afraid to come into our pharmacies to receive their immunizations, or because we are afraid to administer those immunizations. For years, pharmacies have now been places where many patients go to receive their immunizations, especially the influenza immunizations, because we don't require appointments, because we're convenient, because we are available at all hours of day and night in some cases. So the things that I would like to propose for us to consider are some changes to our workflow. So is it possible for our patients to fill out the forms in advance so that they're not spending as much time in our pharmacies when they arrive? Is it possible for them to send those forms to us and bring us a written copy of the form after they arrive, a signed copy of the form, so that we can keep that on file? Are we able to process the third-party claims prior to the patient coming into the store to ensure that, again, the patient spends the least amount of time possible inside our pharmacies? Are we able to manage our patients either virtually or using the drive-through in order to minimize the number of patients waiting in store? So could we have our patients go through the drive-through to drop off their paperwork, not to have their immunization administered in the drive-through? Very important distinction. Or could we have our patients, if they send in their paperwork or drop it off through the drive-through, could we have a way to electronically alert them when we're ready to administer their immunization, so they can literally walk into the store, receive their immunization, and then potentially do the waiting outside in the parking lot in their car without driving their car, or do their waiting in an area where they're at least able to socially distance, or can we schedule appointments in a way that allows patients to limit the number of people that they come into contact with when they're doing this? And again, patient screening for COVID-19 symptoms would be extremely important here. The other thing that I've heard talked about an awful lot lately is the possibility of administering curbside immunizations. So for those of you that don't know, the VA has been doing actually drive-through immunizations for quite a while, but the VA is sort of an entity of its own, right? They work under a different set of rules. And so they do this. As a pharmacist, I personally would not feel comfortable administering an immunization to a patient in a drive-through at any point in time, right? So one of the things that I've been reading about a lot lately is curbside immunizations, which is different from drive-through immunizations in several ways. With curbside immunizations, what would happen is the patient would drive up to a designated area in your parking lot, and they would park their car there. The patient would fill out the paperwork that would then be collected, the processing would be completed, and the immunization would be administered to the patient while they're sitting in their car. The patient would also be asked to remain sitting in their car without driving for at least 15 to 30 minutes, depending on whatever your regular procedure is for ensuring that patients are not experiencing any adverse effects after immunization. As we all know, adverse effects and serious allergic reactions can occur with any dose of a vaccine. So whether it's the first dose that the patient is receiving or the 50th or the 100th dose that they're receiving, it's always important that we monitor patients. There is actually guidance from Tennessee Department of Health on curbside immunizations, and it should be listed in my references. If it's not, I'll gladly share it in chat in a few minutes. And I would encourage you to look at that if this is something that you're considering. However, keep in mind, we live in a litigious society. So if you do opt to administer curbside immunizations, make sure that you have forms that clearly instruct the patient to remain in the parking lot, parked position for at least 15 minutes before they leave. Make sure that the patient signs off on that, and make sure that you always, always, always keep a copy of that so you don't get yourselves in trouble. So that's most of what I have to say, and I am almost right on time, just a little bit over time. But I would also like to hear from some of you and suggestions that you might have with regards to things that we could do as pharmacists to provide these services to our patients to ensure that our immunization rates for influenza do not drop significantly, to ensure that we protect our communities against influenza as best as possible in the upcoming season.
All right, everyone. Any questions?
Hey Garth, or store owners, is the supply of PPE to administer immunizations still reasonably priced and available?
Well,
Reasonably priced, with availability could be a little tough, but go ahead, Patricia, sorry.
I was just going to say the same thing. If pharmacies are able, so I've reached out to several pharmacies to sort of figure out where they stand with regards to PPE. And from what I understand, when it's available, it is relatively reasonably priced if they're getting it through their distributor. But the availability does seem to be limited. So that is going to be one of the major concerns going into this season, is that we really don't have as much PPE available as we used to, and that, you know, right now we have pharmacists reusing their masks. We have pharmacists wearing their gloves for multiple hours at a time, even while serving patients and sanitizing the gloves, which is concerning to me. So I'm hoping that, you know, we still have almost 2 months before we start immunizing, and 3 months before we really get into the thick of the flu season, or flu immunization season, I should say. And I'm hoping that that situation would improve by that time. I have also heard stories of pharmacists, you know, performing COVID-19 testing and not having enough PPE to actually feel like they're able to do it safely. The other concern that I've heard from pharmacists is, I am pregnant. So how do I administer vaccines safely when I'm pregnant? And I guess there isn't a lot of, obviously we still don't know an awful lot of things about COVID-19, but one of the things that I would consider is at least trying to find an N95 mask for the healthcare provider to wear, because that should at least help decrease the risk of transmission of viral particles to the healthcare provider from the patient, and obviously always making sure that the patients are wearing a mask, whether it's a surgical mask or a cloth mask. Before we end, let's go ahead and take a look at our question that we looked at earlier. And I believe you should have the ability to raise your hand in order to vote. So let's give that a try. So the question again was, which of the following is true regarding vaccine administration during the COVID-19 pandemic? Select all that apply. So how many of you believe A is true? So I see our students raising their hands. Good job, guys. You are absolutely correct. Pharmacists should continue to administer vaccines when necessary. And I personally would consider influenza vaccine a necessary vaccine for all of our patients. B, pharmacists should utilize appropriate personal protective equipment while administering vaccines. Yep, so again, this is a correct statement. C, pharmacists should determine whether workflow changes are necessary and appropriate to ensure safety and well-being of their staff and patients. Again, that is a correct statement. And then D, pharmacists should delay administration of all immunizations until the COVID-19 pandemic is over. Thank God no one raised their hand on that one, because we really, again, we want to make sure our patients are appropriately protected as much as possible. The other thing that I actually learned a few days ago by listening to an IPhA webinar is that one of the things that Australia did very differently from the United States is when they announced their stay-at-home orders, what they said was, you should stay at home, but if you need an influenza vaccine, you should come out and get one. As you all know, their flu season is opposite of ours, so they're actually just coming out of their flu season. And because of that approach, it appears that they actually were able to maintain their immunization rates appropriately. We kind of just came out and said, for the most part, most states said, you know, you should shelter in place or you should stay at home without necessarily putting that caveat about immunizations out there. One question that came up in the chat is, are face shields recommended for pharmacists during administration? So eye protection is recommended. Whether you achieve that in areas with with high level of community transmission, eye protection is required. So whether you achieve that eye protection with face shields or you achieve it by using goggles, I don't really think it matters. Face shields are kind of nice. If you're wearing a mask and you wear a face shield over it, it protects your mask as well. Excuse me, but if you don't have access to a face shield, I would at least consider wearing goggles. Any opinions on starting time for this season's flu? So no, unfortunately, no predictions that I've seen yet in terms of starting dates, but typically November through February is peak flu season. So if you can immunize all of your patients by October, that would be amazing. Face shields are recommended. They are not required. So CDC does not set forth requirements. They do provide recommendations. Going to a work site and immunizing. So my pharmacy does on-site flu clinics in the fall. Are there any special recommendations for going to a work site and immunizing the workforce? There are none that I've seen so far. One thing that I would recommend you keep in mind is that it will also depend for the area that we're in, or for Illinois at least, it will depend on where we stand with regards to reopening. So right now in Chicago, we're in phase 3 where you shouldn't have a gathering of more than 10 people, which means that a lot of the offices, if they're opening back up, they will work to have no more than 10 people at a time available. So I would follow sort of a collective of the recommendations that we're seeing with regards to reopening, as well as following the best practices for helping reduce the transmission of the disease. Is there going to be, okay.
Vidria, first off, I just want to say, sorry, thank you for doing this. I also have a really quick question. And I don't know if you can answer this, do you have any idea if there are any sort of special PR or just kind of ways to get the word out as far as immunizations for the flu coming up? Because people are still going to be scared. So is there any sort of special PR thing that they're going to try and put out to encourage people to still go ahead and get their immunizations? Thank you.
What I can tell you is that all of the manufacturers that manufacture influenza vaccines are certainly keeping that in mind. Their biggest concern right now is that they need to make sure there is someone available to administer these vaccines to their patient, or to the patients. So I spoke to a representative from one of the manufacturers recently, and she indicated that they had sold out of all of their influenza vaccine doses. But again, their concern is whether or not pharmacists will want to actively participate in administering immunizations this coming season. And that was actually, she specifically said they are concerned about pharmacists' willingness to administer these vaccines. So the manufacturers are working on a campaign. They have MSLs going out to physicians' offices, and they have MSLs going out to pharmacies and talking about the upcoming seasons and things that can be done to help maintain immunization rates in the upcoming season. I would also imagine that most of the corporate offices for all of our major pharmacies are working on some sort of a campaign to indicate things that they have done in order to be able to draw the patients in and actually have them receive that vaccine in safe conditions. So I would assume there's a lot in the works. I know CDC keeps updating their recommendations. So I've been working on this presentation for about a month now. And every single week, every single time I go back to the CDC recommendations, they have changed a little bit. They've been tweaked a little bit. And this newest guideline that actually breaks it down by, for childhood immunization, it actually breaks down the recommendations with regards to the amount of community transmission of COVID-19 and things that should be taken into consideration. So what they say essentially is that You administer vaccines as soon as feasible in areas with substantial community transmission of COVID-19, and you give priority to at-risk patients. In areas with minimal to moderate community transmission, you should be creating plans for administering pediatric immunizations to all patients. And then in areas with minimal or no community transmission, they actually recommend just continuing to provide these services to all patients. So I would say there are a lot of things that are being worked on, but in terms of what exactly or how much advertising there will be, I can't speak to that.
So Dr. Foster said in his immunization update for IPHA that there is going to be a campaign specifically about going back and getting your immunizations caught up, and particularly for the flu season. They also want no one to vaccinate for seasonal flu in August. They want it moved. They don't want you to start until September. And older people should start in October so they get the length of that vaccination over the winter period. And I was just on the Capitol IPHA call today on the vaccination system for the public health departments, and each public health department will be responsible for providing information to the public and to healthcare providers for the vaccinations. There's going to be a big push to make sure all healthcare workers and providers and frontline get their seasonal flu shots, as well as the high-risk people that we typically use. So that was a 3 o'clock call today, and it'll probably change by Friday.
The great thing about being on an IPHA call, we have all these people who can give us the inside scoop.
Hank, you have your hand raised.
Yes, I was going to raise the same point that Starlin just covered.
So,
out of respect to redundancy, I shall not speak.
thank you, Hank. There are a couple of questions on the chat. So one was, we usually wait until September to begin vaccinating for the flu, and Starlin actually just addressed that also. The recommendation this year is to wait till September to start. Another question, how do we gauge the moderate community transmission, as true numbers of spread are not necessarily public knowledge? So the CDC actually on their website has a listing of all of the states, and they list what the level of transmission, of community transmission of COVID-19 is within specific areas and specific states. So that's sort of what I would use to guide the decisions with regards to that. And I don't have the website handy, but if you just look at coronavirus cases, CDC, if you Google it, it pulls it up. It's one of the first links that comes up.
I think, Garth, isn't it on our website? Don't you put the links to it right there?
It should be, yep.
The other thing is, if you go to worksite, does someone want to talk about going to the worksite? It all depends on what phase we're in September.
Yeah, so I did kind of mention that earlier. It all depends on where we stand. And I would take the phase that we're in and the recommendations with regards to the phase and sort of try to match them up with the best practices recommendations from CDC with regards to PPE and approaches to make sure that these are administered adequately. But
one good thing about worksite is everybody can have their paperwork done, and so you could socially distance and vaccinate in a clean conference room, and everybody would have their paperwork done. But it all depends, because if only 25% of the workforce can show up at the job, then you're only going to get them in 25% waves.
The other thing is, I remember a few years ago, I did a flu clinic at a local generic manufacturer, actually. And it was a very well-run clinic. But what they did was they scheduled each of the employees to come down in like 5 or 10 minute intervals. I believe we had 4 immunizers at that clinic. So we only ever had 8 people in the room to begin with. And that would be, if I was looking at administering immunizations at the worksite, that would be the model that I would want to follow. So tell each patient, you come from 12 to 12:05 or 12 to 12:10, so that they're not even meeting each other in the hallway as they walk by. And Garth, I'm going to turn this over back to you.
Helps if I'm unmuted. Any other questions? This was a great discussion. All right, then I want to pause the discussion, pause the recording so we can put up the. All right, everyone, we're now transitioning to our COVID open town hall. Again, we worked on this pretty well with muting your microphones and raising your hands when you have a question. And we do have our chat feature. Before we kind of do the review of statistics that we've done every week, I do want to remind everyone that there is still time to sign up for our IPhA MTM certificate training program offering on June 10th. So that is next, not this Saturday, but the following Saturday. There is still room available. We have it open for a maximum of 20 people. This is for, being brought to you under our CDC 1815 grant that we have been working on for the last couple of years with the Illinois Department of Public Health. And because of this being partly grant funded, the registration fee is $59 instead of $350. So please do take a look at this. Again, the program is half filled, but there is still some seats available, and it is maxed out at 20 people. This will be offered completely through Zoom, and again, will be offered on June 10th, not this Saturday, but the upcoming Saturday. Still plenty of time to get through all the materials, and you end up with about almost 20 hours of CE out of it. So it's a nice way to take care of that CE if you still are trying to get, if you've still been late to the game a little bit this year and trying to get your CE taken care of.
It's June 20th.
Right.
You said June 10th.
Did I? That's today. June 20th.
Yeah. I would love that we could put more time on the calendar, but.
Right, exactly. June 20th. So with that, our stats that we've seen today, and before we go forward here. Sorry, Shane, I lowered your hand before unmuting you here. Hang on one second. Go ahead, Shane.
That's all right, Garth. I just had a quick question about the signature requirements with COVID-19. I was going through the past guidelines yesterday, and it was pretty clear through all of them that it was going to be until the national, disaster or the emergency was lifted on state levels too. But when I looked at Humana, it said that it was just until the end of May, and we couldn't get any guidance as to whether Humana is requiring real signatures after June 1st. I was wondering if you had any information on that, or if anybody else has brought that up.
No, I have not seen for Humana, because I know a lot of companies, PBMs have extended to well into June, not only for COVID, but because of the disruption from patients because of the recent protests. So I know that Caremark put out some override codes today, and are not worrying about signatures, and Express Scripts did the same thing. So but it doesn't surprise me that Humana is trying to be the odd one out here. So we may need to get in hold of them.
All right, thank you.
No problem. All right, jumping back into the stats, as you can see here, our stats are at 7.3 million cases worldwide, just under 2 million cases for the United States. Of course, we will probably be passing that within the next 24 hours. And one thing I did want to bring up in the stats this week, since we haven't really focused on it as much in the past number of weeks, is you may see over on the right, I don't have it where it says global deaths. I think one thing we need to be really starting to focus on and focusing more on is global recovered. And we're at 3.4 million people who have considered to be fully recovered from COVID-19. And I think that's significant whenever we focus more on the death rate than we do the recovered rate. And I don't think it gets talked about near enough. So, and I think that number would go up even higher if we had better contact tracing in the United States and follow-up tracing, because we are still, at least from Illinois, I know they're doing it as an electronic voluntary survey. So there needs to be a little bit of a harder effort in making sure that there's better follow-up for individuals after their post-infection state. In Illinois, we are at just shy of 130,000 cases, but we have been downward trending over the last almost 2 weeks, which is amazing. We're at 625 new cases for today. That's down from 172 cases yesterday. We're just over 6,100 deaths. And as I said, on recovered, we don't have a complete number on that. And somehow we are only at 101 of our 102 counties that haven't been affected. Somehow Scott County somehow has missed having an active case. But as the governor said this past week, that doesn't mean that the citizens of Scott County should just completely ignore the rules. More than likely, Scott County residents have been identified as sick in other counties. It just hasn't got reattributed back into Scott County. So probably Sangamon and other counties have taken that load off of Scott County. So just still, we need to be vigilant as we're out there in our communities. And I really appreciate, I've been seeing a lot of communications of member pharmacies on social media that you're recommending face masks. Some of you are reopening your lobbies over the next week. And I think that's great. Just, we recommend that both pharmacy staff and patients who can tolerate, please have face masks while in the stores. And I'm really glad to see everyone starting to open their practices back up as we start to hopefully all move into phase 4 by end of the month. And as we talked about social distancing by using the cell phone data, Illinois continues to be at a grade of F, but I think because of recent events within our communities, not only with increased crowds at protests, but also with the warmer weather that we were seeing in the couple weeks prior that we were already talking about as the state moved into phase 3. Social distancing, as we've talked about, has not always been adhered to, but that's been the biggest challenge for a lot of our communities, and not just Illinois. Most of the country, except for North Dakota, is at a D- or an F right now. So again, just try to, within ourselves, try to set a good example when we're out in our communities, and also try to set a great example in our own practices. Let's see here. Someone said that that Scott County had tested only 200 patients. And that's definitely a lot lower than what we've seen in most of the other counties. So now we've opened it up to your questions. So whatever questions and comments you may have, please let me know. Either raise your hand or put your question into the chat box, and we can proceed with your interactive portion of the meeting. We've got well more than 15 minutes left, so I want to make sure we utilize that time for you as much as possible. Don't everybody jump at once. Yeah, go right ahead, Victoria.
Sorry, I don't know how to raise my hand yet. So Laura, one of these
days.
That's
all right, you're good.
But I just wanted to comment on vaccines because actually I learned a lot of new things in the last couple of days with regards to the SARS-CoV-2 vaccine and vaccine development. And I just wanted to share in case anyone else was interested and didn't get a chance to see that information. First of all, I don't know how many of you know that there is an operation called Operation Warp Speed. I'm sure Starlin is well aware of it, but there is actually an Operation Warp Speed out there that is intended to essentially support development of COVID-19 vaccine by January of 2021. And over the last couple of days, it was actually also in the IPHA bulletin today. I was told a couple of days ago that 2 vaccines were selected for it, and it was Pfizer and Merck vaccines. And then today, IPHA actually sent out a bulletin that says it was also AstraZeneca, I believe Johnson & Johnson, and Moderna vaccines that were added to that pathway. So there is some chance that we might actually see a vaccine as early as October, but hopefully no later than January with this project if everything goes according to plan. And if that does happen, then we need to also consider if we can co-immunize patients with this vaccine in addition to the influenza when they're coming into our stores, hopefully to get them.
I love the Spaceballs reference. Thank you very much, Shane, for adding that in there. Someone asked that I know that we're pushing for pharmacists to test patients at community pharmacies at the start of this. Have we heard any update on this, or has this been taken off the table since we are seeing a downward slope of cases for now? We're definitely not taking this off the table. What's causing us as a big pause right now is making sure you can get paid for it. And that is the biggest issue we're having right now with COVID testing. Medicaid is surprised, and this should not be a real surprise to anyone, is continuing to put up a barrier saying that they didn't really think about reimbursing pharmacists. And that just means that they're going to take their slow roll at any changes, because it would mean that they would have to, 1, recognize this, and 2, allow us to bill through the medical portal. They are, we do know that there are many major chains that are providing COVID testing right now, but a lot of that is going to cease really quickly, probably by end of the month, because they were given federal block grants and most of that money is quickly drying up. And once those block grants end, they will have to be doing traditional reimbursements as the rest of us would be. And those policies, as we said, aren't established. And I know IPHA and some of the nationals, Starlin's been on a lot of these calls in the background, working on specifically on Medicare. And we're just going to have to continue to push CMS. As we know, CMS is continuing to state that they've made a blanket statement saying that they prohibit any barriers, and it meant more regulatory barriers to pharmacists being able to order to administer, but that also needs to be interpreted as reimbursement. And hopefully we can push HHS to do a little bit stronger, if not requirement, to Medicaid to actually step up, because we're not the only state where this is being a problem. As we know, Ohio, which has been another major state along with Illinois in the COVID efforts, their Ohio Medicaid said, oh, that's nice that you want to provide it, and we say no. And so they're having to get their governor's office involved, and we've engaged along with IRMA and ICHP into the governor's office, and they're starting that processes to have those conversations. So we're continuing to push, and we will push until we get this right, so we can help make sure that Illinois gets started back on its feet. Because in our point of view, for Restore Illinois to really work, pharmacists have to be involved in testing on an ongoing basis to get us fully back to phase 5. Yes, Darlene?
So HHS just is proposing giving supplementary monies to Medicaid to make sure that there is not any social inequity of the delivery of the vaccine when it comes, or the testing. So when that becomes written in law, then I think I think that's HHS's way of trying to push Medicaid to add us but the Medicaid's going to get their money and they're going to do with it as they wish unless somebody audits it. So.
Right, because all they got to do is say that we're not providers under HHS's definition. Yeah, I know it. And so we're going to continue to push. We're not going to let this go down lightly because this, like we just said, this is going to be essential. We have the ability to do this. We are the most successful healthcare provider, and we can help Illinois get back on its feet. Any other questions or comments?
And I'll also tell you that there are actually 11 vaccines and clinical trials across the world. And on top of Warp Speed, there is an international sharing collaborative that involves private industry, the public governments, and then it's not WHO, they've created a whole new group so that they can put all the information in one database and share. As soon as one gets results from something, it's shared to all the organizations that are being involved. And then NIH is spearheading the WARP group, and then so that there's instant communication all the way across the board. They're trying to get rid of the silos. So there are 5 that are ahead of the 11 in the race.
Abby, you've got your hand raised. Hang on one second. Go right ahead, Abby.
Thank you so much, Garth. I just want to follow up and applaud you and other states for moving us forward toward reimbursement. Given my expertise being on the advocacy group for Illinois, I think a lot of time when I talk to a representative, they really are moved by actual stories. So if we bring to that forefront stories from our patients, not just us advocating for ourselves, stories from other healthcare providers like physicians, I'm confident that we'll get it done this year.
I agree with you. It does take advocacy, and it does take the stories of what's going on with our patients, and because that does translate to those that vote for the representatives. So do make sure you continue to share those when you have the opportunities to engage with your local representatives. Laura, I see that you're unmuted. Go right ahead.
Oh, thanks. Yep, I forgot decorum. Dr. Kahale, given your public health background, have you been able to meet with any of your representatives as a constituent, like via Zoom? Are they taking meetings, or have you been able to kind of get FaceTime with them the last 3 months?
Thank you, Laura. Can you hear me okay?
Go ahead, Abby.
Yeah, so I would say some of the representatives, after we got that advocacy letter to be signed and sent to them, they've been really emailing me nonstop. And I can tell you some of them on a daily basis. So I think having that connection through a letter, and also when we see them hopefully one day in person, it makes a difference. But I think what I've heard from them, and I can share with you a specific story that I heard from one representative, and that told me on the weekend when she needed someone, it was a Sunday night, none of her providers, not the physician, not the nurses, no one picked up the phone. The only person who answered her phone call on the weekend in the evening was her pharmacist.
Okay. Exactly, and that's what I'm talking about. So if you, I appreciate that you're encouraging everyone to do that. I think it's not natural for us to boast about ourselves, but if you can share that, especially with Roosevelt, that our faculty are in direct communication with legislators, I think we put that on independent pharmacy owners a lot because they're small businesses and they're in the community, but even we can have that effect, and that is really important.
Yeah, and I'll just share with you, Laura, that Michelle Musman in Schaumburg was very supportive of our efforts to expand the services in Illinois. specifically contraceptive services. And we've arranged a meeting with her. She literally gave me her cell number. So we were texting, and I think it takes that connection, as you said. So I'm happy to help.
Yeah, I had no idea because I've been in contact with Mussman, so and I thought that we had shared that with. I know I shared that with Melissa. So yeah, if we can definitely not everyone, you know, if you can have duplicative efforts and work together, that is awesome.
Sounds good. Any other questions or comments this evening? Go right ahead. Andrea, you're good. Oh, I think I muted you again. Sorry. There you go.
I figured out how to raise my hand, first of all, so I'm proud of myself. All right. Second of all, before we close out for the evening, I just want to thank everyone for being here tonight, and a special thank you to Starlin for all of her expertise. You are a wealth of knowledge, lady.
Well, thank you. It's you know, when I attend a lot. I'm here, so when it's out there, I try to be on there because I know all of you guys are working hard in the front line, and I feel that it's my duty to have all of your backs. So Garth and I try to be on as many of these calls as we can possibly be. We've had Susan on some of our calls for us, so we spread it out. We have our pharmacy student, so we spread those calls out because we always get just like it's blah blah blah, and then they'll hit it, and it's getting that information so that we can then research it and make sure it happens if they happen to share that. So thank you, and thank you for your outstanding work. And everybody on this call, thank you for being in the front end. I do want to tell you that it was noticed on one of the calls that the pharmacists have been running toward the fire, and some of our primary care givers have not been running toward the fire. And so we just need some more of those pharmacist stories like Laura and Abby and everybody has been saying. So collect that information. If you're afraid to brag, email it to me. I'll brag about you. You know how I am. So we do still need those stories. We're still collecting those stories because that is what, especially patient stories, that is what translates into constituent votes. So thank you.
Emily, you are, well, almost. Hang on. Emily, you are unmuted.
Okay, so this may be preaching to the choir, but the Freakonomics podcast, it was episode 416, How Do You Reopen a Country, was really interesting because at the end they talked about how we should be utilizing pharmacists. And I'm sitting here, my husband was asleep, and I woke him up because I'm listening to it. It was brought to my attention by two different people that aren't even medical professionals. We were like, you need to listen to this. It kind of focuses on California because they interviewed a pharmacist from there, but they kept bringing up the statistic, and I'm going to get it wrong, but about how everyone lives with 95% of people live within 5 miles of a pharmacy and how we're so accessible. Mm-hmm. And they were really pushing it. I'm just sitting there thinking, yes. So go check that out.
Emily, which podcast was that again?
Freakonomics.
The Freakonomics? Okay, thank you.
Yeah, it was episode 416. How do you reopen a country? Yeah.
Okay, thank you. All right, everyone, we're right at 8 o'clock. Any other questions or comments?
And if the Roosevelt students can stay on, we'll have a little